Good morning, everyone. I have a big challenge, which is to keep your attention after a long session and to keep you in the room before the lunch, but I really will do my best to do it. You know, when we discussed with DJ Pite on July last year on the possible project just to make local production of alcohol waste and rub solution, remember how it was. We were absolutely in the very hot phase of the outbreak, and we were quite a little bit crazy. I mean, just to send alcohol-based or hand sanitizer was possible, but I mean, it's just a dilemma between to provide fish or to teach the fishermen just how to catch the fish. I will just show you the first picture that I presented to Dr. Dan, the current Minister of Health in Liberia, and also Moses Massakoy, and we were speaking about anesthesia. You know, anesthesia was very, I would say, low level in Liberia because anesthesia is only provided by nurse anesthetists. And it was very important that when you have a sequoia tree, which is very small, it's very important that to stress on the quality of the roots. And if you want to become very tall, you need to have very big roots. And that's why, in the other words, is back to basics. First of all, we started from the WHO formula, which was, I would say, officially validated, and we have, I would say, a consistent formula that's helped us just to start the project. The objective was, first of all, to get the agreement of the Liberian authority. It means that as the Swiss Agency for Development and Cooperation has a presence for a long time in Liberia, we are well known in the ministry. It means that it was quite easy for us just to get the support and the agreement of the authority. The next step was also the validation by the local authority of the WHO formula. You know, WHO formula is becoming from the International Organization on Health, but it has to be approved by the local authority, which was very important also. The selection of the hospital. Selection of the hospital was also a very important moment because, first of all, people are very focused on Monrovia because Monrovia is an easy access. But also, it's very important to think that Liberia is not only Monrovia, that we stress on the importance to go in a rural hospital too. The other point is, among the 3 hospitals that we selected, we wanted to have one hospital who was more specialized on mother and children care. That's why we decided to go to Redemption Hospital in Monrovia, to JDJ, which is one of very well known for the mother and children care, and also to Phoebe Hospital in Banga. It started with the delivery of the 10 kits of production. It was prepared here in the pharmacy in University Hospital of Geneva, and once again, thanks a lot to the lot of people who just work on this. And it was shipped by plane. And after 2 days session were provided by Dr. Lozeni from Mali, who will just arrive, is on travel now, and who provided those sessions in Monrovia. Some pedagogical materials was provided too, and also under supervision, they prepare the first batch of the alcohol-based unrub solution. One of the points was also the quality control, which is not so easy, which is still an issue, and also the evaluation of the project as the project is moving on. How does it look like a kit of production? You see it's a lot of plastic bottle, a big quantity of plastic bottle. It's 1,500 bottle. Some can of glycerin and peroxide, and also some ethanol meter, some jerry can, etc. It means that basically you see it's not a huge quantity of equipment. It looks very, I would say, magical, you know, a kit of production of alcohol base, but it's, in the end of the day, very basics. But it needs a lot of, I would say, commitment and rigor just to work and to do it properly based on the GMP standards. The cost of those kits are 3,000 Swiss francs, which are, I would say, the Swiss costs. For sure, the goal is just to help them to provide it or to purchase locally. And for sure, if you purchase it locally, it will be, of course, much more cheaper. The question was, the local purchase. Local purchase, it started from ethanol, because ethanol, you can't send it by plane because it's dangerous goods. It's just impossible to send it by plane. And you know, if you think how we did in September 2014, we were able to find 220,000 liters of ethanol in Sierra Leone available immediately. You know, when we found this, we more or less got the impression that we found gold, because it was just crazy to find this at this time. The quality control, very important too, and it seems that it's still an issue because it's a little bit too complicated. It's something that we have to discuss also with Benedetta, Professor Bonabri, and Professor Pittet. The selection of the facilities, selection of the pharmacists, the agreement, support, supervision, and also the funding, even if it is not very, very expensive. You have some pictures of the production. You see the boil water, which is not distilled water, but it's just boiled water. And it was the venue where the course were given. And you see the pharmacists just preparing the first batch, and they were very committed to do well. The evaluation was done after several months, and you get the figures of the number of plastic bottles of 100 milliliter that were produced by the different pilot sites. You see the quantity is quite impressive. The other point was 21 licensed pharmacists were educated in addition of one laboratory technician during 2 days. And the evaluation shown that, in fact, 80% of the time of the pharmacist is spent on a regular work. It means that just to produce alcohol-based on-rep solution takes only 20%. It means that it's realistic and feasible. It means also that the standards were applied on the production, and also the staff of the hospital were using, and they were informed about the alcohol base. Pilot site, that I told you, that's Redemption, JDJ, and Phoebe. And the other one were the School of Pharmacy and the other hospital that I will show you on the map. You see that we started with 2 urban and 1 rural. Sorry, but the circle moves a little bit when I just upload the slides. You see the next hospital that we selected on the second phase. And you see all the hospital together that include, in fact, the School of Pharmacy. The selection was done all the time by the Ministry of Health and Social Welfare. It's not up to us to decide which hospital has to be selected, but it's done all the time by the local authority. You see the first batch, which is quite a nice moment. Once again, remember how it was, how difficult was it in the field, and when you see people doing this just for their own, it's just amazing. It's absolutely amazing, and they were very, 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 very proud to produce this for their own and also for the local staff. Something that I have to say that I was also in Guinea some weeks ago, and we are trying now just to implement the same project, as well as we're going to do it also we will do it in Sierra Leone too. In fact, you know, for instance, in Guinea, ethanol is not produced anymore in Guinea. It means that they are fully dependent of the external or international import. That's why it's very important that just produce alcohol-based on-rep solution might be an opportunity to restart the culture or the agriculture of sugarcane or another plant, to restart a distillery, and to also just to support the trade. It means that beyond just the local production of alcohol-based, which will have a quite important impact on the health system, it's also a nice opportunity for the civil society just to go ahead. And for sure, if you start something, as it was mentioned by one of the speakers, it's very important to think about autonomy and about sustainability. The take-home message for me is it was very difficult for me just to explain to non-health professionals what IPC is, because it's very complex. And for them, just to make a confusion between alcohol-based and IPC is very, very, very easy. That's why, for sure, it's very important that alcohol-based unwrap solution is the first step, but a very important step from the IPC strategy. And it was a very, very cost-effective project. You know, I will disagree with my previous speaker. For me, I absolutely witnessed a total collapse of the health system. You know, we have in the audience Garrison, that you will see on the next picture, who work in redemption. And for sure, the picture that you have on the right, on the left-hand side, show you that how was the situation in normal life, and it was the situation in September, and it was also the same situation in November. I mean, people didn't get place to go, and we saw so many issues on this. And once again, when you think about children, just to remind you that 43% of the population are children in Sierra Leone as well as in Liberia. That's why they are the most vulnerable. And last but not least, if we want to help them, just to provide the basics, just to provide a basic IPC measure, which start with the local alcohol-based unwrap solution. Thank you so much.